Hello and welcome to your favorite health program, the Health Center with Ozion at Kunye. Still your host and regular anchor, Ozion the Expressionist. On today's edition, we'll be discussing gallbladder pain. Gallbladder pain affects our body from the right side of the abdomen because that is where the gallbladder is located. It is located under the liver. The liver is here, the gallbladder is here just under it. This is the pancreas, and that is how the substance that is in the gallbladder flows from the liver and stores here, and that substance is called bile. Now, the bile produced from the liver and comes and stores in the gallbladder, and the gallbladder holds this and then transports it into the small intestine. What are the functions of this bile that are stored in the gallbladder? The bile helps the body in a lot of things. It helps in metabolizing protein, carbohydrate, and fats. It helps in digestion of fats. Specifically, it helps in synthesis of blood clotting factors. Now, what are blood clotting factors? Blood clotting factors are factors that help in preventing us from profusely bleeding unstoppably. Yeah, when you are hurt or injured and you begin to bleed, if not for the blood clotting factors, your bleeding will continue incessantly, unstoppably until you die. So because of these blood clotting factors, we're able to achieve clotting or the congelation or the kind of a halting of the blood from flowing incessantly or unstoppably. Okay. It also helps the body in controlling of the blood volume, helps in wasting or removal of toxic substances from the blood, and other functions you can see on the screen. So it's very vital. Absorption of vitamin K, because it's the vitamin K that helps in the blood clotting as well. So these are the functions of the bile, and the bile is very essential. In the bile, you have a lot of things. You have cholesterol, you have the bile salt, you have the bile acid, you have the pyramate, you have the calcium salt. All these help in all these things that it helps as its functions. But where does this pain come from? How does it happen? What actually causes someone to begin to have gallbladder pain? Gallbladder pain comes from gallbladder stone. Most often, 90% of the time is the gallbladder stone. Then what is the gallbladder stone? Or I call it gallstone. Gallstone, medically called cholelithiasis, is formed when these substances or the bile begins to congeal. Why does it congeal? These substances begin like the cholesterol most often increases in a very higher proportion that it begins to affect the bile acid and other substances that are in there, and it will be congealed or form some crystals that makes it unable to travel through safely or smoothly through that duct. So most times it is the cholesterol, and that is why cholesterol is being monitored in anybody, or rather is always the guilty thing that causes your gallbladder stone. So anybody that has this disease, the causes is most times or most often the cause is about your cholesterol intake. So, and we have discussed cholesterol, remember. So now we just have to highlight what causes cholesterol to increase like that. The food you eat, it could be equally from the kind of genetic disposition or familial connection, or familiar history. Your family, your mom, your dad has this kind of condition that makes you to equally inherit it or have that kind of disease condition. So, but basically, even if you have those risk factors, if you keep eating certain foods like saturated food, fats, the fats we're talking about, food like red meat, and you are eating it disproportionately, that you consume it without moderation, you eat, let me just list these foods. There's certain things, you're eating milk or processed foods as well. So certain food you eat that cause your cholesterol to increase without moderation should be monitored. You should be careful with the kind of consumption of food you eat, because this food will cause your cholesterol to increase, and when they increase and being synthesized in your body, the amount of cholesterol you have in your body will be more than the body would need, and the composition in your gallbladder can cause this kind of condition we are talking about. And why are we concerned about this condition? We are concerned about cholelithiasis because of the pain. We are concerned about the problem of gallbladder because of the pain. Gallbladder pain occurs when this crystal wants to travel through the duct. The cholelithiasis, when it is stored, when it comes to that place, it changes name because it could start causing you inflammations, and it's called cholecystitis. It could still have another name at the duct when it begins to inflame at the cholangeal area. It's called the uh, choledocholangitis. So there are a lot of names given to it, but basically I want you to know that the problem is about those stones. When they congeal and they are traveling, they begin to pain you because when they are just there, you wouldn't know it's asymptomatic. But when it's traveling, when it's moving, you begin to have problem. And you know, it moves most often because you have eaten. Yeah. Or even you breathe, it will want to travel. So when your body moves, it wants to move. Moves by, maybe you breathe, everything draws. Maybe you eat, and it wants to go and digest. And the pain is terrible. I'm telling you, it is a very horrible pain. Like you're being stabbed. And that's why it doesn't really last so long. It can last for like 20, 30 minutes, but that, even if it is 10 minutes, you wouldn't like to have it at all in your life. It pains that it goes into your head and makes you crazy. You can equally fall on the ground and be screaming until it goes out. You think everything is normal. It will continue until you attend to it. If you don't attend to it, gallbladder pain can kill you. Yes, it can. Because this is your body. And when something affects you, makes you mad like that, a lot of things are being disorganized and it affects you in different ways. So focusing on this, what other symptoms happens to someone who is suffering from this? Because this bile has certain other constituents like I've mentioned. And there is another constituent there called a bilirubin. Bilirubin is the yellowish pigment that helps in coloring your feces and makes it that, look that nice, yellowish somehow. When you see your feces, your stool. So it does a lot of good functions in the body, helps as it comes out with the bile. So, but when this yellowish pigment is stopped from flowing, it goes back into the blood and begins to manifest. First of all, shows in this your vesicular area, the eyes. Your eye begin to yellow. Yeah, jaundice. At some point, it begins to show on your skin, yellowish. That's one of the symptoms of gallbladder stone. Then it could equally cause another symptom is nausea, vomiting, diarrhea. These symptoms and on the screen. So these symptoms come to the are presented in the person that's suffering from this problem, and the person suffers a lot of pain. So when this happens and you don't attend to it, it could reach to a point that you begin to itch your body. Why does this itch? You begin to itch because of the increased bilirubin, increased bile salt. Sorry, the bilirubin is the color. The bile salt, which is the content of this bile, will begin to deposit on your skin, and you begin to scratch a lot. You begin to suffer itching. So, but don't allow it to reach that point, because at that point you must be going crazy, and it might be causing you a lot of other complications. So what do we do to somebody who is suffering from this pain? That's the thing. If you're suffering from this kind of pain that equally radiates to your back, to your shoulder, it pains you at this place, like you're being stabbed, you could hold yourself here, you're prepared to go out, and you won't go out again because the pain is so much. And you're diagnosed of this disease by, when you go, it could be diagnosed using the endoscopy, it could be diagnosed using the basically the ultrasound can say this, CT scan, many other devices can be used to diagnose this disease. And when this is diagnosed, no need to waste time. Discuss with your doctor, and this organ, the gallbladder, will need to be removed. Yeah, don't be afraid of it, because people live without it, and it helps you a lot when it is removed. The gallbladder wouldn't stop you from any other thing you're doing. Once you have removed your gallbladder, you are better, and because the bile will still be flowing and be doing its function in the body. So there are some organs in the body that we are lucky to have, that when they are removed, it doesn't really hurt us, and we wouldn't even be requiring a lot to manage it. You still live safely and better with it. So The thing we are focusing on here is how do we
How do we
manage it?
prevent it?
We have to manage this
Prevention
by
prevents it.
exercising when we are eating, and eat less of these fats, so that you, especially these saturated fats, especially these foods that will predispose you to having this kind of condition. Like every other condition we have mentioned, the diabetes and the rest of them, those food, we need to increase our intake of vegetables, which helps in production of fiber and as well as production of the good cholesterol. You need certain, the exercise is very good because it has to reduce the calories that might overflow when it is not needed, to giving you this kind of after synthesis metabolization to get causing you problems, so like there's a over production of bad cholesterol that deposits and begin to form this. So it must not be an obese person for this to happen. The body size, however, is not the issue, but you also need to be weighing yourself to know how much you are adding to your body. But exercise, exercise is very important, as I always say. So these conditions, like I've said, can only be managed when we watch our diet, when we check ourselves of the pains that are happening to us by going to see the doctor to know exactly what kind of pain are we having, because it might just come and go, and the health is called the biliary colic. It will just come and it goes because it's being flushed. Just like when we will discuss the kidney stone, you will understand what I'm saying clearly. But let's know that gallbladder pain is very devastating, it's very terrible. It's not something that you need to hold. When you go to your doctor and he suggests uh, removal of gallbladder, do not panic. There are other problems in the gallbladder that could cause you that, and that's of maybe that you have an infection in your bile duct, the cystitis, like I said. But then, most often, you still need to remove your gallbladder. But if it is something that antibiotics will treat, doctor will equally tell you. There are conditions like that antibiotics will treat because it's just infection and not just in the, and that will be treated. A lot of other problems there could be treated in different ways. But this is just to let you know that your food, the food you eat, your body needs attention when you're talking about gallbladder and anything that happens here. I will see you again, but please look at the screen and see other things that may not have been mentioned on this particular topic. And we discuss on the comment section by asking your questions, and we continue from there. Still me, Ozion the Expressionist, and I'll see you at this time. Take care. Health is wealth.